Thank you. My name is Bruce Stillman. I'm president of Cold Spring Harbor Laboratory, and I want to thank all of you, quite a remarkable turnout on such a beautiful Sunday afternoon, for the joint Cold Spring Harbor Laboratory and St. John's Land symposium. The music is probably one of the most interesting topics for us because most of us enjoy music. There are some who don't, and there are disorders of people who don't enjoy music, in fact can't stand music. But most of us do. And I wanted to point out that Dagnia Zaidlitis, who's head of our Vice President of Communications, sent me an email this afternoon pointing out there's an article in the Times that today is the 10th anniversary of the iPod. And so it's probably appropriate that we have a symposium on music. Think about how that has changed everybody's lives. So we are one of few species that can appreciate music. Birds can appreciate music, but I think we have a lot more sophistication in our appreciation and composition of music. And how the brain does that is absolutely fascinating. Cold Spring Harbor Laboratory has been focusing on the brain since the early 1980s. In fact, one of the first scientists that we hired to study the brain is now the president of MIT, Susan Hockfield. And she went on to lesser things than studying the brain. But it is, the program we have is very interesting. And we have a program that now is about 14 faculty who study not only how the brain works, how we perceive things, how we compute things, how we make decisions, how we do cognition, but also what goes wrong in the brain, especially in disorders such as autism, schizophrenia, bipolar disorder, and severe depression. And it is really, I think this century is going to be the century of understanding the brain. And so I think it's really fantastic that we have the joint St. John's Land Cold Spring Harbor Symposium. And I want to welcome my co-host, Mary Jean Webb, who's the director of St. John's Land and also the board of St. John's Land here, and all of you. And introduce Peter Kohler, who's Vice President of Cablevision Systems for Editorial Services, who is going to moderate this afternoon's session. So thank you all for coming, and I hope you enjoy the program.
If you like old horror movies, even scary spoofs, as I do, Halloween is your film festival. It's amazing when you see these old movies again how music plays a key role. In one of my favorites, the Mel Brooks parody, The Young Frankenstein, the monster can only be calmed by music, the notes echoing eerily from hidden chambers in the castle. Mel Brooks' monster was fitted with a brain, not as intended, a specimen from a genius humanitarian, but another specimen, brain from a jar labeled as belonging to someone named Abby, or as Igor finally remembers, Abby Normal. So the question to be explored by our symposium this afternoon, music, how it can rewire your brain, is an old question indeed, running through our literature, mythology, science fiction, popular culture, from Mary Shelley to Mel Brooks. But our good fortune is that this question will be put to our expert panel of speakers who will bring their insights to explore this question from three perspectives. Our first speaker, Professor Ann Churchland of Cold Spring Harbor Laboratory, will examine this question from a scientific perspective, something Dr. Churchland is well qualified to do as she studies how brains make decisions, integrating inputs from our multiple senses, storing memories, and then how we process information using the circuitry that connects everything. Perhaps she can tell us what we are learning scientifically about the role music can play and how we perceive music. The question of how music rewires the brain will be explored from a therapeutic perspective by Connie Tomeno, Executive Director and co-founder of the Institute for Music and Neurological Function at Beth Abraham Family of Health Services. Connie is a Stony Brook graduate in music performance in the trumpet, who developed an abiding interest in music therapy. Shortly after joining Beth Abraham as a music therapist, she began to notice how patients in the dementia unit responded to music. Recognizing its clinical potential, Connie not only went on to co-found the center at Beth Abraham, but continues to make news nationally and internationally, especially through her collaborations with neurologist Dr. Oliver Sacks, whose books champion the benefits of music therapy. The third perspective, the practical implications of music therapy, will be explored by Irene Kabrood and Stephen Finch, musical collaborators who are well known to us in the Huntington Cold Spring Harbor community for their teaching, conducting, musicology, and for those remarkable occasions when you can hear Steve and Irene performing as husband and wife, singing a duet. We look forward to learning more about work that Steve and Irene have undertaken at St. John Nursing Center, where Steve is bringing music therapy to Alzheimer's patients and others with cognition problems. Please consult your programs for more about the fascinating and rich backgrounds of our speakers. And please also give note to our sponsors, Cold Spring Harbor Laboratory and St. John Nursing Center, as well as those who have generously provided additional support, Mr. and Mrs. Robert Gay, Bank of America Merrill Lynch, Mrs. Valdemar Jacobson, and Keene Development Company. Our format provides for presentations from each of our speakers, and when they have concluded, I'll invite them to reassemble here, and we'll interact with a few questions that we'll raise for all of them, and then open the floor for mics to bring the questions from you. So with that, let's begin. Dr. Churchland.
All right, thank you very much for that introduction, and thank you for having me here today. It's a great pleasure to be here, and a wonderful very large group of people assembled, so it's great to have so much enthusiasm for this topic. My laboratory here at Cold Spring Harbor works on multisensory integration. We're interested in how the brain puts together pieces of sensory information that come from different modalities, such as vision and audition. So studying music in the brain is a little bit different from what we do every day in the laboratory, but it nevertheless does have some connections to our work and is both a fascinating topic from a scientific point of view, and also, as my other panelists will discuss, it turns out to be really of great clinical interest and importance as well. Just a little roadmap for what I'm going to tell you about today. I'll start by telling you how ordinary sounds are processed by the brain so that you can get an idea of the neural circuits that play a role in our perception of auditory sounds. Next, I'll tell you about how musical sounds are processed by the brain, and you'll see that much of the circuitry is overlapping with ordinary auditory sounds, but there are some important differences as well. And then finally, I'll tell you a little about why musical stimuli can sometimes be so rewarding. I think many of us would agree that experiencing music is a very special kind of sensory stimulus that's very different from other kinds of auditory signals that we might encounter and can have a very kind of intense, emotional, very pleasurable sometimes feeling. And I'll talk a little bit about why that might be. Okay, so I'm going to start here by telling you about how ordinary sounds are processed by the brain. And this is a picture of a human brain here. And when a sound comes into the eardrum, this causes a really very complex cascade of mechanical, chemical, and also neural events. And this begins in the cochlea, which is over here. I'll tell you more about it. And then goes through a number of subcortical and then ultimately cortical pathways that sometimes results in a perception. And the goal of auditory neuroscience is to understand how this happens. And musical sounds share much of the same circuitry that's used for ordinary auditory sounds, but there are some differences as well that I'll highlight later in the talk. So this here is the cochlea, and this is a blow-up of the cochlea plus some extra machinery here. And the cochlea is a really fascinating sensory organ The way that it transduces sounds and allows us to experience sounds in our brains is with these very special cells called hair cells, which you can see here. At least you can see the very tops of them here. And they live inside the cochlea, inside a fluid. And when there's a sound in the environment, this makes your eardrum move back and forth, and that, through a couple of other steps, causes the fluid to move back and forth. And then that causes these hair cells to move. And the reason that this allows the sensory signals to get into the brain is because they have this really neat structure. The little hair cells, you can see they're different sizes, and they're connected to each other by these little things called tip links. And when the extracellular fluid moves the hair cells, then they actually open up, and this allows the ions in the extracellular milieu to flow into the cell, causing the neuron to fire. So they're really very beautiful cells and very effective at turning sounds in the environment into a signal that our brains can actually perceive. So after the cochlea, the signals go to the superior olivary complex, which is where the cochlear nucleus is, and a few other subcortical structures. Just a couple of points about these. The first one is that an interesting thing is that when you hear a sound, the first spikes in the cochlear nucleus are about 1 to 2 milliseconds later. So that is an incredibly fast transduction time. And that means that whole process that I just described to you, the eardrum moving and the fluid moving and the hair cells moving and opening up and ions flowing in, all these many steps happen very, very quickly so that sound gets into your brain with just incredibly rapid speed. And just for comparison, when you see something, it takes not 1 to 2 milliseconds to get to the first stage of sensory transduction, but more like 30 or 40 milliseconds, so many, many times longer. And the consequence of that is that the visual system and the auditory system are operating on really very, very different time scales. And the auditory system is really very well designed to detect things that are happening very rapidly in the environment. And it can tell us, and other organisms as well, a lot about time for that reason. So after the superior olivary complex, the signals go through the inferior colliculus and the thalamus. I'm not going to say too much about these subcortical structures, except to please keep them in mind, because Connie will return to these in her talk and tell you how they have some importance clinically as well. And then finally, the sensory signals make their way to the cortex, and that's the top of the brain, which is quite enlarged in primates, non-human primates, and in humans as well. We have a very large cortex. This is a side view, so you can see the cortex a little bit better. The green part of that brain is the temporal lobe, and the auditory cortex is in the top part of the temporal lobe. And the cortical processing of sounds, and of musical sounds in particular, has been something that's been of great interest recently. It looks like these cortical structures are quite important and differ a little bit for musical sounds compared to other sounds such as speech or much simpler auditory stimuli. Next, I'll tell you about how musical sounds are processed by the brain, and they're processed in a slightly different way. This has turned out to be something that's a little bit challenging to study and to understand, and I'll tell you why this is in the context of telling you some of the kind of basic approaches that people have used to understand how musical stimuli are processed in the brain. And this turns out to be a pretty challenging thing to do, and it's challenging for the following reason. In the slides I told you about a moment ago that have explained our understanding of how simple auditory signals are processed in the brain, the reason that scientists have been able to figure this out in such great detail, the many different areas, the different times it takes to process, is because they can use animal models that hear in a very similar way to humans do. And having an animal model makes it possible to really understand a circuit in great detail and to make great progress in understanding how it works. But music is very different. Animals mostly don't seem to experience music in the way that humans do at all, although there may be a few exceptions. In general, they don't seem to have the same experience that we do. And so that means there isn't really an animal model that we can use to understand how the brain processes music. And this makes it really quite challenging to study. A second challenging aspect is that humans are really quite different from each other when it comes to how they experience music. So a few examples are subjects who are trained in music have really rather quite different brains from subjects who are not trained in music. And even if you compare among musicians, a musician's response, neural response to hearing his or her own instrument is different from the response that they get to hearing another instrument playing the same song. So music causes all kinds of changes in the brain, some of which are very interesting, but it makes it difficult for scientists to really get a handle on what's happening in the brain. So nevertheless, this has been a topic that's been of interest to people for really many years, and there has been a ton of progress made in this field, some of it recently. So the few approaches that people have taken, oops, wrong remote, is that people have used behavioral studies, and I'll give you an example of those a little bit later in the talk. They also use what are called lesion studies. So sometimes there will be a patient that will have a brain injury of some kind resulting from a stroke or other kinds of insults to the brain, who will have a change in the way they experience music. Perhaps they're no longer able to perceive musical sounds that they could before, or perhaps they were not musical and then become musical. And by looking at the damage to the brain and connecting that to the change in the behavior, scientists and doctors can make inferences about how the damaged structures are supporting the perception of music. But as you might imagine, this can be a tricky thing to do because sometimes the patients will have lesions that are a little bit different from each other, so it can be quite difficult to generalize. So that's sort of a challenge of that particular approach. The final technique that people have been using to understand how the brain processes music is techniques that allow us to look at what human brains are doing. I've listed a few of these techniques up here. fMRI, or functional magnetic resonance imaging, is one that's become very popular recently, and that makes it possible for scientists to measure the regional cerebral blood flow into different parts of the brain and to see that happening online, perhaps when subjects are experiencing music and so on. And that technique is not without its challenges as well, some of which I'll tell you about when I go into a little bit more detail about how these techniques are used. So I'll give you an example of a kind of study that's been done using fMRI that's been interesting in revealing how subjects are able to perceive the tonal aspects of music. So we're going to leave the kind of temporal rhythmic aspects aside for a moment, although of course those are important as well, and focus just on the tonal aspects. Okay, so how are they going to go about doing this? So first what they do is they take a bunch of volunteers and put them in the fMRI scanner so that they can measure what's happening in their brains. And then they played for them a little tune, which I'll play for you. Okay, so hopefully you'll agree it's sort of a pleasant tune. And this is a little melody that just runs repetitively in an endless loop. It gets modulated through all 24 major and minor keys in a specified order. And they played this little tune for eight volunteer subjects who did have musical training. But you might wonder, okay, now wait a minute. You might be skeptical and say, well, if you simply look at subjects' blood flow, look at their brains while they're listening to this music, how do you know that the responses you see really have anything to do with tone perception? And in order to find that out, they had to design the experiment in a pretty clever way. So what they did is they had two conditions. One where there was a mistake in the frequency that was played, so they played the wrong tone. And another one where the tones were always correct, but sometimes one of the tones would be played with a flute instead of with the timbre that you just heard a moment ago. And then by comparing the subject's neural responses on these two conditions, they can tell what parts of the brain are involved in tonal perception. And this is what they found. So this is a fMRI showing images of many different brain slices. This is like looking down from the top. And every time you see a little red or yellow square, then this tells you that this is a part of the brain that was selectively activated by the tonal task. So a part of the brain that contributes to the tonal aspects of music perception. And the main point I want to make about this is that musical stimuli, even just the tonal aspects, activate widespread neural circuits. They engage many, many different neural structures: the prefrontal cortex, parietal cortex, the thalamus, the cerebellum, superior temporal gyrus, and the middle temporal gyrus. So many, many different aspects. So it looks like there's really a broadly distributed network of areas that work together to allow us to interpret music and the tonal aspect in particular. One thing I want to draw your attention to also is that the activation is not completely symmetric. So for tonal tasks like this one, there's a little bit more activation on the right side of the brain compared to the left side of the brain. And we wouldn't want to overstate this. It isn't that the left side of the brain does nothing. There's lots of activation on the left as well, but there's a bias towards having more activity on the right side of the brain, compared to the left. Okay, so that tells us a little bit about the tonal aspects of music. But as we all know, when you experience music, the tones that you hear aren't the only important thing. The rhythm and the timing are an equally compelling part of music. And one thing that turns out to be really interesting is that the tonal and the temporal aspects are mediated by somewhat non-overlapping structures in the brain. And this, to me, is really interesting. When most of us experience music, we don't have the sense of, oh, well, yeah, there's the frequency of the music. Oh, yeah, well, there's the timing. You know, gosh, aren't they both nice? We tend to sort of feel like it's one coherent percept that we experience all together. But that percept that we have isn't really mirrored in the brain. In the brain, the temporal and tonal aspects are mediated by different machinery. And the colors are a bit hard to see here, but I hope you can get the basic idea. This was a different study comparing tonal and temporal aspects, and they found that here on the right, there's a large portion of auditory cortex and also the superior temporal sulcus that are involved in just a tonal task. And here on the left, there's a greater activation of auditory cortex for the temporal, the rhythm task, suggesting that there are really different networks that are mediating the two aspects of music perception. Okay, so just briefly, some more evidence that there are different neural structures comes one piece of behavioral evidence. This is kind of interesting. You can try it on yourself after the talk if you like. So it turns out that subjects can more easily tap a rhythm of the dum-da-lum-dum, dum-dum, that would be a rhythm, with their right hand, and of course the right hand is activated by the left part of the brain, again suggesting that the temporal aspects of music are mediated by the left part of the brain. And then there's clinical evidence as well coming from lesion studies, which suggests that there are differential effects following lesions to the left and right hemispheres. If you have a lesion on the left hemisphere, you have deficits in timing, but pitch is okay. If you have lesions on the right hemisphere, you have deficits in pitch, but rhythm is okay. So they look like they can be separately taken away or spared. Okay, so finally, just very quickly, because I'm running out of time, I'll tell you a bit about why musical stimuli can sometimes be so rewarding. And again, this is a study that's done with fMRI, but this time not looking at cortical structures, looking at subcortical structures. And these are all structures that are from the ventral striatum, which is a part of the midbrain, very evolutionarily old part of the brain. It's the same in monkeys, in humans, even in mice. And they found that when people are listening to musical stimuli, they see a lot of activation in these reward pathways. And these are the same pathways that are involved in other kinds of rewarding behavior, such as eating, and even the same circuits that are involved using certain kinds of drug use, such as cocaine and methamphetamine. And those are drugs that give people a very rewarding experience because they cause dopamine release in these particular parts of the brain. And the musical stimuli look like they're doing the same thing. So, well, what does this mean? One of the preeminent music researchers, I think, put this very nicely, so I'm going to quote what he said. He says, music may be one of a class of human constructs that elicit pleasure by co-opting ancient neural systems via inputs from the neocortex. So what he means is that we have this very evolutionary old structure in the midbrain, and the musical stimuli kind of take advantage of or piggyback on what's already there. But you might wonder, well, why would this be? Why would auditory stimuli cause the reward circuitry to be active in any event? And the reason people speculate is that auditory signals can be have tremendous social relevance. And this is true of many, many animals, most of which, of course, don't experience music. One example of that is a mouse who has some young pups, a mother mouse. Her brain becomes very selective to the particular calls of her young mice so that she can go and retrieve them when they run off into wherever little baby mice go. And similarly, with birds, they have a very, very temporally and spectrally precise song that they sing that's incredibly important for mating and for other behaviors as well. I'm going to play that for you. Okay, so this zebrafinch, which is the kind of bird that's studied extensively for songbirds, repeats the same song over and over again. And I don't want to argue that the zebrafinch experiences music in the same way that humans do. Probably they don't. It's a very different kind of song. It's the same motif repeated many, many times over the bird's life. But it nevertheless suggests that even in animals that don't experience music, they already may have some circuits in place to have a rewarding experience to specific kinds of auditory signals. And again, it may be that in humans, our brain have kind of piggybacked on those signals and that explains why music can be so incredibly enjoyable and pleasurable. So to conclude, auditory stimuli, both musical and non-musical, can be processed in many stages throughout the brain. Musical stimuli are processed in some specialized areas, both in the left and the right neocortex. And musical stimuli activate evolutionarily ancient reward circuitry. So I'll stop there and
the importance of music and using music as a stimulus to help people recover function or to develop function, especially in children with developmental delays, is so crucial. And to be able to have the scientific community interested in how this works and why this works is really important to us, to be able to then be able to deliver this as a clinical treatment, hopefully. And hopefully the treatment will become more refined as we learn more about the interplay between music and the brain. As Peter mentioned, my background here in Stony Brook, even though I ended up as a trumpet performance major, I started out as a pre-med biology major. I think I ended up in music because I wanted to take trumpet lessons and somehow ended up in the field of music therapy. My first experience, as Peter mentioned, was in a nursing home back in the early 70s. And any of you who remember where nursing homes used to be back then, they weren't as nice a place as they are now. And so imagine being in a room with people who I was told by the doctors and nurses had nothing going on. Don't expect anything from them. They're at end stages of dementia. They don't know who they are. They don't know where they are. They can't speak. They don't respond. And I started started singing a song, Let Me Call You Sweetheart. And the people looked up, opened their eyes. Some of them started singing words to this song. And what I realized right then was that there was something about music that could awaken and stimulate responses in individuals who seemed to be unresponsive. What is it about music that allows this stimulation to take place? What is it about music that informs us about things? So that brought me into this about music in the brain. You heard that I've worked with Oliver Sacks for the past, since 1980, so almost 32 years. And he, in his own way, was looking at music with his post-encephalitic Parkinson's patients and wrote about this in his book, Awakenings. What is it about music that informs action, that informs or stimulates emotion, that tells us who we are when we forget who we are? This is why it's crucial that we connect with neuroscientists and those interested in the mechanisms by which we understand sound and sound processing, because it's only through this relationship that we can start creating those types of treatment that can actually help change the brain and improve brain function as much as possible. The field of music therapy in the United States is, I guess we're over 60 years old. It was founded in the early 50s. It's now an organized profession with standardized exams and certification processes. And music therapists talk about the interplay between the clinician and the client because, as Anne mentioned, that we're all different neurologically. And any of you, if you were to share your musical likes and dislikes with your neighbor, you'd probably be very surprised at how much you differ in your likes and dislikes about music. So throughout our life, we form these relationships to music that then start developing these structures in our brain that we can rely on. So the music therapist needs to be able to perceive the nuances in the response of a client so they could tweak the music to enhance that response. Some of the clinical applications in music therapy deal with things like poor attention, sensory integration, emotional processing, memory deficits, poor motivation, stress management, depression, psychosocial withdrawal, balance, gait issues, fine motor dexterity, agitation and aggressive behaviors, and even acute and chronic pain. I'm not going to address all of those issues right now. I'm going to focus on two primary areas because the most salient when we talk about music therapy and music to help people with neurologic impairment. One is the area of music and memory. Why does music affect us the way it does, and what is it? Well, Anne spoke about this a little bit. When we listen to sound, I think about my patients, my Alzheimer's patients. Music is noise. It's sound in the environment. There's something about that sound that our brain is able to construct and differentiate between noise and create a structure for, and that's because of the way we're able to hold on to those sounds and create melodies and harmonies. But without being able to do that, it's nothing but environmental sound. So something about music calls our attention away from the background noise and makes us hold our focus to that. The repetitive structure of music allows for enhancement of attention and an enhancement of information processing because it's the repetition that we create the informational structures for. So think about words to a song. Many times you'll hear a new song and you can almost predict where the melody is going to go or where the word is going to go because of your expectation of what that structure is, just based on your learning experience throughout life. So that structure is important too, and music informs that structure when something is lost. The other piece about music is if it's important and salient enough to us, we listen to it long enough, then any emotions or feelings or historically important information that's connected to that gets repeated enough that those constructs go into long-term memory. And it's precisely that long-term memory access with music that allows us to reach people with dementia and memory problems. A lot of music has to do with arousal, paying attention, calling our minds to something that's happening in the environment in the here and now. With subjects with attention disorders, be it children or with adults who've lost the ability to pay attention, both novel sounds and familiar sounds and melodies can stimulate that response. Familiar sounds could be a favorite song, it could be a person's voice. I don't know if you've ever had a family member or know of somebody who was in a coma, who came out of that coma and will say that they heard their mother or their loved one speaking to them. So we know that this type of auditory recognition happens even if there's not a conscious state present. One of a well-known researcher in memory systems is Larry Squire, who differentiates between explicit memory and implicit memory. And a lot of what we do in music therapy relies on overlearned behaviors and responses to music. So a lot of what I'm going to talk about is about procedural memory, memory that's been overlearned and very well constructed in our brain. So when a person isn't able to initiate that response anymore, they're informed by the structure and the sounds of music to allow that response to happen. But we also can use music in an explicit way to recall things, such as telephone numbers. Any of you who know the commercial, dum da da dum 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 da dum, Empire. We use, people who write musical jingles know, and the advertisers who pay for them know the importance of music to keep memory intact and to inform memory. If commercials didn't have music with the telephone numbers, we'd probably never recall what those numbers are. So there's a lot of clever way music is used for something called mnemonics. It's the way we've learned the alphabet in our life, A, B, C, D. Without that musical structure, we probably wouldn't remember all those letters as well. Music and memory with songs, the familiarity of favorite songs and tunes allows us to retrieve words when the person can't retrieve those words on their own. I don't know if any of you know somebody who's had a stroke and can't speak, and everybody's always amazed at how well they can sing. we can use that singing ability to trigger and prime word retrieval, even though singing and word and speaking are slightly different neurologically. They share enough pathways and networks that we can actually stimulate some of this recovery. There's also some skills and habits that we can inform through the tempo patterning of rhythm and music that allows somebody with a stroke to walk when they can't walk on their own, or somebody with Parkinson's disease to initiate function. And I'll show you what that looks like. It's very important because what we hear from clients is that they're not thinking about walking when they listen to music. They're following the sound. And so a lot of scientists now believe that we're bypassing the executive function of the prefrontal cortex, the motor startup system of the brain, and allowing the person to just follow the flow. So without this thinking about doing, they're actually able to do very well. And I'll show you examples of that. So in some of the music mnemonics for memory, we talked about phone numbers, names, addresses, phrases. I don't know if any of you studied for your test by putting some of the formulas to songs, but you know how well that works. So we know that we can use music to remember singular things, but also most importantly, and especially in the work with people with Alzheimer's disease and memory problems, is the idea of autobiographical music. Can music inform us of who we are and where we've been? And that's really the purpose of music therapy for people who have dementia or even early memory loss, is that key experiences in our lives are paired with songs. I'm sure all of you have a favorite song. You could think of your first date or your first dance. Maybe you don't want to think about that first date or first dance. And in that case, that music won't have the pleasurable response, but you may have some negative experiences to music as well that you can't get rid of because that autobiographical connection is so strong. And also the emotional connection to music. And showed you some of the bilateral pathways of the auditory system. One of the things that struck me early on was the connection of the auditory system, almost an immediate connection to an area of the brain called the limbic system. That's in the midbrain. And it's a part that's very much involved with emotional arousal. So even if you can't remember the facts of a piece of music, the emotional connection to that music is still very strong. And many times you'll see somebody smile or laugh to a piece of music even if they can't talk. And so you know that there's an individual connection to that piece of music. And gave you a different slide of Peter Giannata's work. Peter Giannata is a neuroscientist who's interested in music perception and music development, and he works at UC Davis in California. Just recently, he published a series of papers looking at autobiographical music and where in the brain we light up when we hear music that has specific importance to us. His work is important because it's the first time that we're looking at the overlap in regions of the elements of music that make it autobiographical. It's familiar songs, songs with strong memory components, pleasing songs, combination of familiar and autobiographical. And I'll tell you what those different areas are in a second, but what you see is that there's an area of the medial prefrontal cortex that gets lit up in each of these situations. So a piece of autobiographical music actually brings together or meets in that area of the medial prefrontal cortex. There's a suggestion that that particular area of the brain is still functioning in people with Alzheimer's disease and dementia. That's one of the things that Dr. Giannata is talking about. Is that why people with Alzheimer's disease and dementia respond to autobiographical music, or that they can process it? Is it because that part of the brain is still intact enough that when each of these different elements of personal music converge in that one area, it stimulates it enough to allow this response to take place? So the prefrontal cortex has been noted for things like self-knowledge, mentalizing, perception of others, outcome monitoring, and action monitoring. So in a sense, when we listen to a familiar song that has personal importance, these components are also stimulated. Autobiographical music from the survey that Peter did with his subjects, some of their responses when he said, well, what did the music make you feel like? They said happy, youthful, nostalgic, excited, energized, and love. So when you think about your favorite song, you can easily see how many of those elements are part of that song. But most of all, when people were asked about their favorite music, these were the two elements that came to play: the personal aspect, its connection to a person, and also the time period. So that pretty much, I think you would say for yourselves too, that your favorite music is usually connected to somebody that means something to you, or a time period of your life. In fact, research that's been done in the music we remember the most tends to be, or the music we remember the best, tends to be the songs that were popular through our late teenage years, through our early 20s. And the reason for that is that we start creating a sense of self, a sense of who we are and who we're going to be during that time period. It's when we start making associations to groups of people, not just isolated, but our social world becomes embedded in those friendships and those relationships. And so you can see why time and person and place become so connected to our favorite and familiar music. So what does this look like with somebody with dementia? Sometimes it's not too obvious. And in this example, what you're going to see are two women who are in our nursing facility. One is very verbal, although she doesn't speak clearly all the time. The other one's mostly nonverbal. But I'm just going to show you a little clip of the first woman, because in this situation, I know she knows the song I'm going to play. I know it's something that she spontaneously sings from time to time. But in this case, she's not singing. In fact, I have to play the song for about 15 minutes before she responds. And so what it tells us is something else about memory loss and dementia, that many times there's a cognitive slowing, that even though the person seems that they can't recall something, it's not that they don't know it. It means that it takes them a while to process it and to be able to respond. Many years ago, I heard a linguist by the name of William Condon give a talk. And back then he was studying children with cerebral palsy. And he was studying language development in these children. And years ago, it was really believed that children with cerebral palsy also had severe mental retardation. And so his tests were to look at the language development in these children. And sure enough, when he tested them, each one of them would consistently get their answers wrong. And then one day he was analyzing his audio tapes and had fast-forwarded one of them and heard the correct answer. And he said, wait a minute, how could that be? All my students, these students never get an answer right. It turned out that the child was answering the question correctly 2 questions after the fact. So there was a time delay in processing. And when he realized that, he started leaving 2 minutes in between the question for the child to be able to respond. And sure enough, found out that kids with cerebral palsy actually were very high mentally and very high IQs, and really changed the way education was made available for these children. Well, with people with Alzheimer's disease, what's very apparent is that it takes a while, or may take a while, for them to respond. And if we just walk by in the nursing home and say, how you doing today, and just don't get a response and just walk away, we may have lost a moment to really engage somebody. And so what you'll see is me playing. I'm not going to play for 15 minutes because you'll be bored. But I'll fast forward you'll see where it's fast forward in the video clip. And after that 15 minutes, she comes in singing perfectly, no delay, totally in that moment, 100% connected. Okay, video.
You know this song? You are my sunshine, my only sunshine. You make me happy when skies are gray. You'll never know, dear, much I love you. So please don't take my sunshine away. You are my sunshine, my only sunshine. You make me happy.
To me, that she doesn't even know what I'm
when skies
doing.
are gray. You'll never know, dear, how much I love you. So please don't take my sunshine away. You are my sunshine, my only sunshine. You make me happy when skies are gray. Yeah. So you know that song.
I love the sunshine. You make me happy, and skies are blue. You never know, dear, how much I love you. Please don't take my sunshine away.
Very good. You are my sun, my only sunshine. You make me happy when skies are blue. You'll never know, dear,
How much I love you. Please don't take my sunshine away.
very good.
Okay. Okay, you can stop it now. Thanks. So it takes her a while to respond, but when she does, she's absolutely connected. Now, many people say, well, so what? It just happens in the moment. There's no carryover. But what we found is that if you maintain this kind of stimulation and connection over time, that memory and attention does improve. And in fact, one of the studies that I did showed that even mini mental status scores can improve because the person is now engaged long enough to allow for those abilities to come back. Something that you would never think of, because you think of dementia and Alzheimer's disease as being rapidly progressing and finite in its debilitating condition. But absolutely, in the early stages of Alzheimer's, if you can engage, think about what learning is all about. It's about engaging your mind and holding that engagement, and that's how we learn. Well, this is one way of doing it. I'm just going to show you a couple of more videos to show you about music and movement and motor control, because that's another area of therapeutic application that's crucial and much used in music therapy. Important aspect is that music and rhythm is at our core. In fact, some people say that we're wired for rhythm, although hardwiring in the brain is something that we don't want to talk about because we do develop networks as we experience the world around us. But the fact is that a child upon birth is already able to distinguish beats and to process that. And why is that important? It's important for them to understand language, to follow the nuances of their mother's lullaby so they could pick up the patterning of speech early on. It's also important for coordination and movement. And this research shows that something called beat induction, which they found is actually already processed in the fetus at 5 months gestation. So even before the child is born, this ability to respond to beats is already there. Well, that's important in music because it allows us to make music together, to coordinate things, to dance. But it's important for people with neurologic diseases because it helps stimulate and give the patterns of movement when movement is no longer possible. Probably one of the most striking things is in somebody who's had a stroke. I don't know if you've seen this, but many times people with strokes who recover their physical ability, even if they can walk, they still tend to drag one side and really can't get the ability to lift it. In this example, you'll see where somebody who has a hemiparesis on one side is dragging his left leg, is able to cue that step to the rhythmic pattern of the music. And you'll see where his left side is absolutely in time with the music. It's something called rhythmic entrainment and something that we use very successfully in music therapy. Okay, video.
Gee, it's great after being out late, walking my baby back home. Arm in arm over meadow and farm, walking my baby back home. We go along harmonizing a song. I'm reciting a
So in this case, when I talked about bypassing the executive function, that's exactly what's happening. He's just following the music and not really thinking about it. And that's what allows for that coordination of movement. Okay, you could stop it there. Similarly, people with Parkinson's disease, this idea of motor entrainment, of a rhythmic entrainment of motor function is crucial. In this case, we think that music allows, or rhythm allows for this generator almost to happen in the basal ganglia and the cerebellum, and there's a scientist who's actually studying this. In this case, you'll see a woman who has something called bradykinesia. Brady meaning slow, so she has a very slow movement, and she favors one side. She walks with a companion, but you'll see when the music comes on, she is able to walk unassisted and with total freedom. Okay. Oh. So you can see the slowness in how she's dragging one side, and the unevenness of her gait. She lets go at this point. And again, notice how on the beat her steps are. There's a group of scientists at the Neuroscience Institute in California who are looking very closely at the underlying neural mechanisms of this rhythmic entrainment. It's important because in this case, the rhythm is informing the movement, where the person themselves cannot do that. And the work of Robert Sartori, this is the same lab that Anne quoted from Isabel Peretz and Robert Sartori, Virginia Penum's study, looking at the motor timing mechanisms that include the temporal lobe, as well as the basal ganglia and the cerebellum being the premotor area, sort of the cylinder or battery of motor function. But the basal ganglia, because in Parkinson's, that's the area where dopamine tends to be reduced. And we're wondering now, in collaboration with the scientists, if the auditory circuits, when they get aroused, actually stimulate dopamine in these areas. So, in summary, you can see very clearly how music in therapy can be crucial for people with memory disorders, Alzheimer's disease, very especially for people with Parkinson's disease and movement disorders. And it's our hope that by collaborating with the neuroscience community, we can inform each other and answer those questions that will allow us to bring the therapeutic aspects of music to the greater population of those in need. Thank you very much.
Now we'll turn our attention to you and how you can use music's ability to awaken and engage the brain to help you maintain your cognitive functioning at high levels throughout your lives. We've each had our own experiences with music, and we already know that. As we grew up, we may have sung around the piano with our family. Some of you may have even made up your own songs. Now, as adults, you may revel in the power of the organ at churches and temples that you go to, feel the joy of singing in choirs or playing in orchestras, and relish going to the symphony and opera. Whatever our preference, music is an integral part of our lives and we instinctively recognize its restorative power that reaches into the core of our beings and reconnects us with ourselves. From Connie and Anne's lectures today and what we've learned from science, the work that music and science and neuroscientists and musicians are doing together, we now are confirming and learning more about what we've all known and experienced intuitively. The lead article in the Arts and Leisure section of the New York Times in March 2009, titled Musical Pharmacology, Concerto in the Key of RX. Any of you remember seeing that? You can Google it. It quotes Dr. Michael F. Roizen, the Chief Wellness Officer at the Wellness Institute at the Cleveland Clinic. Listening to finer music and attending concerts on a consistent basis makes your real age about 4 years younger. Whether that's due to stress relief or other properties, we see decreases in all-cause mortality, reflecting slower aging of arteries, as well as cancer-related and environmental factors. Attending sports events like soccer or football offers none of these benefits.
Okay, is that
That's
where
you.
I am? That's where
That's
I am. I'm trying to. Could we have the PowerPoint? I don't know. There we go. There we go. Just leave that there. Well, so far, we've been hearing about individuals, their response to music. What I'd like to address rather briefly is the group participation, choral singing, because it's one of the most stimulating activities that we can participate in. It improves your mood, it releases stress, and it activates the respiratory system. Now, we can do that individually, but it's also socially beneficial, and research has shown that singing in a chorus can actually even elevate your immune system. One important study that demonstrates the power of singing was undertaken by researchers at the University of California in Irvine, using members of the Pacific Chorale. The study involved these saliva tests from the members of the chorale, and it measured levels of immunoglobulin A before and after rehearsals and performances of very demanding choral work, Beethoven's Missa Solemnis. The levels of immunoglobulin A increased 150% during the rehearsals and 240% during the performance. The boost seemed directly attributable to the singer's states of mind, which many participants described as happy or euphoric. So here we are connecting with that pleasure center and its physiological response. Along that line, about 1.5 years ago, I had the opportunity to study the effects of choral singing on selected residents at St. Johnland, the nursing center, with the advice of Dr. Tomeno about what measurements to employ and the encouragement of Mary Jean Weber, the director at St. Johnland, and the assistance of 2 therapists, Carrie Gallagher and Ellen Sheriff, to identify and select the participants. Initial group of 20 was selected, 15 of whom completed the study. The group consisted primarily of people who had difficulty with speech or initiating speech. The causes varied from brain injury to stroke to early dementia, bipolar disorder, and anxiety. A second group of 16 from the dementia Alzheimer's section began at the conclusion of that first study. Before beginning the program, each participant was given 2 standard tests of mental status. At the end of the program, each was reevaluated with the same tests. The groups rehearsed programs of both familiar and unfamiliar pieces, as Connie was pointing out the benefits of each of those different activities, twice a week for 20 sessions, in rehearsals that lasted from 45 minutes to an hour, and then performed the program for residents, families, and friends at the end. So there was an end goal. These were not just sessions in themselves. There was a learning goal in the end. Each session was designed much like a traditional choral rehearsal. It began with physical warm-ups, having them sing familiar pieces in different meters while using arm movements as if they were conducting the pieces. They were also encouraged to move feet and legs to the rhythm if they were able. Both mind and body became energized and engaged. It was amazing to see wheelchair-bound residents singing and moving to a Sousa march with energy and concentration. We continued with vocal warm-ups of various types to aid basic phonation and breathing. We then rehearsed each piece in detail, paying particular attention to enunciation, rhythm, pitch matching, and understanding the meaning of the text, repeating sections as necessary. The repertoire consisted of a variety of songs, as I said, from the very familiar to ones chosen specifically because they wouldn't be familiar to most of the participants. Upon comparing the pre-tests with the post-tests, we found the results widely variable. Overall, however, the participants showed improvement, though as the sample group was small, I don't believe it was a statistically reliable pattern. But that's only half the story. At each rehearsal, it was clearly observable that most of the individuals improved their ability to phonate clearly, became increasingly engaged in the activity, and left in better spirits than when they came. The degree of attention to musical details, such as enunciation and rhythm, was remarkable. Most also retained the newly learned pieces, often with complex words and musical repeats. The effect of the experience on several of the participants was especially moving. And I would love to talk about that, but there's just not time today. If you want to talk later, I'm happy to tell you some of the individual stories there. This small study, along with another published in Canada in 2002, shows the positive effects of group singing. There's continual attention to note, rhythm, and pitch accuracy, proper enunciation. Each repeat of a song conveys new information that may be applied in subsequent renditions, resulting in a sense of progress, achievement, and an increase in self-esteem. In addition to the cognitive aspect, group singing also provides an opportunity for social engagement, to direct attention away from self, and helping to alleviate depression and enhance emotional and physical well-being. A thorough review of published non-clinical research on the effects of singing on mental and physical health was done in 2008. It concluded, given the fact that group singing can be a powerful and moving experience, and given the possibility that singing could contribute to quality of life, well-being, and even health, it's remarkable that so little research has explored these issues, and disappointing that the research undertaken to date is so limited and so variable in character. We hope there will be more done on a larger and more systematic basis. There are benefits for all of us who sing together, not just for those with cognitive difficulties. She wants me to do that.
We don't know, time-wise, if we should choose to do this or not. We can sort of collectively decide. Normally, in the workshops that we give, we would be singing John Jacob Jingleheimer Schmidt together, or we can do bingo. Now, it'll take us a couple minutes. Do you want to try to do it? You want some activities, some singing activities?
Okay.
All right.
The reason that we do this, I ask groups, I ask you to say, okay, you've been sitting here for a little over an hour. How do you feel? What's your energy level? How's that? And then, think about it. Then we're going to come back to that question. All right? Are you ready? Remember how to do this? If you don't, just follow along. You drop a Jingleheimer Schmidt the second time, John Jacob Jingleheimer. Okay. And what has to go on neurologically for this to happen is actually fairly complex. So here we go. We'll pitch there. How's that? John Jacob Jingleheimer Schmidt. His name is my name too. Whenever we go out, the people always shout, there goes John Jacob Jingleheimer Schmidt. Da 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 da. John Jacob Jingleheimer. His name is my name too. Whenever we go out, the people always shout, there goes John Jacob Jingleheimer. Da 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 da. John Jacob. His name is my name too. Whenever we go out, the people always shout, there goes John Jacob. Da 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 da, John. His name is my name too. Whenever we go out, the people always shout, there goes John. Da 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 da. His name is my name too. Whenever we go out, the people always shout, there goes da 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 da. Okay, some people haven't done it before, I can tell. But in that, think about it, in that silence, I don't want to take too much more time with this, but in that silence, what you have to keep going in your head, in your body, to come back in precisely. Okay, now assess, how do you feel? Okay.
Just very quickly, one of the things, Anne and Connie have covered these in slightly different ways, but we just want to go very quickly through a few of the most important aspects to understand about brain health for all of you and all of us. Our brains need exposure to environments that are enriched, complex, and novel. So what does that mean? Learning something new, of course, is always a very good thing to keep doing all your life. Traveling is a very good thing for our brains. Even going to a new store actually helps to rewire your brain. Or
retail therapy.
Or, yeah. Or if you go to the same store and the layout is different, you know how frustrating that is? Oh, God. Stay with it. It's good for your brain. Okay. Environments that are passive and rote do not help the health of your brain. So couch potatoing is out, too much TV, not so good. In order to change, the brain needs attention, repetition, and consistency. You already know well that learning any new skill takes practice and patience to reinforce the practice until the new golf or tennis swing becomes automatic, or until the new piece of music has been learned at all levels of coordination necessary to make it easy to remember and perform. The attention and repetition and the consistency of your practicing, which acquiring this new skill requires, is rewiring your brain, and exemplifies an important principle: attention, repetition, and consistency. Okay, good. The motto of the neurons of your brain that we like to share with you and have you remember is survival of the busiest. So it's just challenge yourself in whatever way you can find out how to do it. Now, normally at this point we would energize your body and brain by doing conducting. And there is actually a wonderful conductor named David Dworkin who has trademarked the word conductorcise and has a whole program, if you want to check it out, on your website. And it's very evolved and just really wonderful. We actually met him at Connie's Institute last fall at one of their openings. But I don't know if we have time now to do any conducting. So in any case, it's an extremely valuable upper body exercise. And normally we definitely include it and teach you how to do it and pick out your favorite music at home and recommend that you do it for 15 minutes at least 3 or 4 days a week.
And I have groups just sing it. Right here, just start singing and moving. But let's move on. We really are running late.
So the next thing we'd like to talk about is brainwave frequencies. A leading researcher, Joshua Leeds, says he's a leading researcher in the study of the effect of music and sound on the human nervous system, says that and this is a well-known fact, so many of you already may know this, the electrochemical activity of the brain produces electromagnetic waveforms known as brain waves. These waveforms can be objectively measured with sensitive equipment such as the EEG. There are 4 categories of these waveforms that pulsate at particular frequencies that are measured just like sound waves in cycles per second or hertz. They range in frequency from 0.5 to 38 hertz. In a normal 24-hour period, we move through many fluctuations in our emotional and mental states. During the day, we're usually awake and alert. In the evening, we may relax, watch TV, or meditate. And at night, we're asleep and dreaming. Each of these experiences is a different combination of the 4 brainwave categories: beta, alpha, theta, and delta. Now let's look at these categories and the characteristics of each. Beta, and these numbers can vary slightly, like we're overlapping the bottom and top numbers of the ones that are next to each other because very often they run into each other, and there are varieties. Some people say that it only goes to, say, to 40, or some say 30.
May I answer something
Yes,
here?
please.
We also know that these are not the only indicators of these moods. There are other measurements of it, but this is one that's easily accessible, and we see it reflected in these EEG measurements and readings. And I think neuroscientists would say that there are also many other factors going on here too. Right. But these are ones that we can immediately grasp and use.
So beta is your mind in everyday life. It's just your normal waking consciousness. Your linear and logical thinking takes place in beta. Your external orientation is in that brainwave. The lower states, 14 maybe to 18, are quite good. If you start to get higher into it, and that depends on each person, that's where anxiety and panic attacks occur. Your alpha brainwaves is a relaxed awareness. It's produced as your mind shifts from the external to the internal world. Daydreaming, visualization, and light meditation, and your imagination are all accessed when you yourself just move into this slower brainwave frequency. Alpha is also the bridge between beta and theta, which we'll talk about next. Theta, 4 to 7 hertz, or maybe 8, but generally 7, it's said. The twilight zone, you know that twilight zone just before and after sleep? You're present, but you can feel you're in a different state. That's your theta brainwave state. It's a very powerful state because that's where your mind, your subconscious mind, is most receptive to affirmations and visualizations. It's also the state of theta brainwave is where we do our dreaming and REM sleep. It's the subconscious mind, as I said, emotional healing, intuition and creativity, deeper states of meditation, and spiritual insight. Delta, the last of the 4 categories, from 4 to 0.5, is deep restorative, dreamless sleep. The unconscious mind, empathy, the deepest level of physical healing, the unconscious intuition and insight are all at this low brainwave frequency, a kind of radar that you may experience, or unconscious scanning of the environment are your delta waves giving you that information. If you're walking down the street and you get an impression that you need to walk to the other side, it's probably your delta brainwaves that are communicating with that to you. So as you can see, each category has a unique pattern of brainwaves. Though all may be present, some may be stronger than others, and you rarely produce only one brainwave at a time. And as we said before, while the brainwaves can be measured with EEG, there's much more complex activity going on in the brain than the EEG is depicting. Now we'd like to move very shortly into listening to some music. Anytime we listen to music, our bodies and brains respond to the pulses and character of the music, creating observable changes in our heart rates, respiration, and brain waves. With specialized technology, professionals in the field of sound work have been able to weave these brainwave frequencies into music and sound to create an opportunity for the listener to enhance their natural ability to go into a deeper state. The wonderful thing about this music with these frequencies in them is that all you have to do is listen, and the music will do the rest. By the time you can play them in the background as you work, study, or spend a day around your house, or you can listen with headphones And at that point, the music, either way, the music will gently and gradually help your nervous system to shift. As you listen, your brain matches the pulses, producing a natural state of relaxation, stress reduction, mental clarity, and healing. Just so that you know, however, it is interesting and important to say that the frequencies only affect a person if they are receptive. Let's listen now for just a couple of minutes to chamber music that has the sound pulses of the alpha brainwave wave woven into it. It's the Adagio from Haydn's Cello Concerto in C. We'll just be listening for 2 minutes. So just before we listen, get comfortable. Put your both feet flat on the floor. Let your hands rest in your lap. Close your eyes and let your attention rest on your breathing, letting it become slower. Relax your tongue. Just relax it a little more so that it floats in your mouth. When the music starts, give yourself over to the music. It will give you what you need. The recordings are enhancing the ability of your brain to expand the capabilities it already has, but may have difficulty contacting. Over time, the listening creates a learned response. With regular listening, you will have trained your brain to more easily access whatever abilities and qualities you wish to have whenever you need them. And we'd like to end with a quote from the English playwright William Congreve. "Music hath charms to soothe the savage breast." We looked it up. It says breast.
The original is breast.
What's it?
The original is breast. In the Victorian era, they changed it.
Oh, did you? Music have charms to soothe the savage breast, to soften rocks or bend a knotted oak. Thank you very much.